everybody uses ClickView really, right from the board level downwards. We've been training everybody from consultants to ward clerks to sisters to general managers to patient flow coordinators, everybody. It shows historical data, so there are reports such as the Trust Activity Report, which shows us where we are against contract, against plan by our CCGs, for all of our point of delivery, so A&E, outpatients, ward attenders, everything. But then it also shows live information as well. So it shows us what's happening in our emergency departments right now, how many patients there are, how long they've been waiting, and also how long patients have been in hospital beds. So we can find out who's in what bed, what consultant they're under, what ward they're on, how long they've been in hospital. What it really has meant is that people have prevented manual data collection, so people have actually been able to spend more time on their clinical duties rather than collecting information for meetings. So they can just go onto ClickView, access live reporting and performance standards, and then bring those to the meetings.
I think one of the great things about ClickView is we've started to use it with learning disabilities, but actually the limits of it are really endless. So we've already started having conversations with other specialist nurse groups around how they can use it. So for example, identifying dementia patients or those with Parkinson's, for example, we could be much more creative with how we manage these patients, which sometimes have really complex needs. And we just need to make some minor adaptations to their pathways to give them a really good experience, but also the very best outcomes.
I spoke to Chris this morning, who's the new registrar. I had thought about digital dictation, decided to do some research, spoke to the girls in the office who helped me a lot, and wrote a presentation, contacted a rep from a digital dictation company, had a chat with them, and then scarily presented at the Dragon's Den and was successful in winning £9,000. Then I along with the help of my colleagues in urology, implemented digital dictation into our department.
The letters can be done and sent to the secretary straight away rather than holding on to tapes for weeks on end or tapes getting lost. Also we can prioritise letters so that urgent letters can get done first.
We got our typing backlogs down from 4 weeks at some stages to 48 hours. Some dictations being typed in the same day within an hour for urgent patients. Financially, we had a vacant post in urology which we didn't need to fill, and we also used some NHSP staff which we then didn't need to use because the backlogs were cleared, and we're managing the work ourselves, so we did save a significant amount of money.
Basically, ClickView is a system where we can proactively identify our patients, particularly those with learning disabilities. So having this system means that we can work much more closely with our community teams. Because we're able to directly identify patients with learning disabilities, we can refer on to them, and that's been particularly helpful in recent circumstances where we've been able to reduce readmissions, for example, and reduce A&E attendances, because community teams are wrapping services around patients, whereas normally they would have been coming into hospital. There's one particular example of a patient that was coming into A&E kind of every other couple of weeks, but actually through some proactive identification and managing the patient more closely at home with the community teams means the patient hasn't come into hospital as frequently. So we really are developing better outcomes for our patients.